welcome to the latest health news that you will not see on the mainstream media. Can chili peppers prevent heart attacks and strokes? It says chili pepper consumption may significantly reduce the risk of heart attack and stroke. Chili peppers contain capsaicin, which is known to help with a variety of health issues from digestion and inflammation to weight management and even cancer, right? So it's really crazy how this component works. Capsaicin is the component that actually makes a lot of these peppers hot, right? And this component actually rushes your water in your bloodstream to these certain areas of the body, like because they actually make a capsaicin cream that you could put on your skin, and it helps alleviate some inflammation, some pain, if you will, associated with such inflammation, because it's causing your body to recognize where is the pain coming, where is the inflammation in the body. Capsaicin actually helps recognize that, but also many internal benefits as well. So it says chili pepper consumption is not a one-stop solution. However, it may not be the best choice for everyone. Consult with your doctor for the course of treatment that's right for you, of course, right? And of course, like chili peppers and things that are very hot can be very troubling for certain individuals. You see people who are Pitta body type in Ayurvedic medicine. You know, you could take a quiz for that online to see what type of Ayurvedic body you have, and you know, looking at Pitta, their element is fire, so they don't want to eat too many hot spices, right? People who are Vata or Kapha might do a little bit better with that, but you still want to be a little careful, right? Because these things are very low dosage, I believe, for many people when you're looking at chili peppers. So you got to be very careful with that, right? And then look at the other spices in your cabinet too. You know, it's not just chili pepper. There's many thousands of plant-based compounds with many thousands of more compounds that have many anti-cancer, many inflammation benefits that you may see there, a whole host of benefits, in fact. So it says regular consumption of chili peppers associated with a lower risk of total and CVD, cardiovascular death, dependent of CVD risk factors or adherence to a Mediterranean diet. So regardless of if you're on a Mediterranean diet or whatever risk factors you have, it says it's associated with a lower risk of your total risk factor there, which is just incredible. It just shows you the plant by itself, how powerful it is. It says those who ate the spicy vegetable had a 40% lower risk of having a fatal heart attack. Their risk of stroke went down more than 50%. The effect was known to be stronger in those who did not have high blood pressure, of course, right? And so that's just incredible stuff there. It says you know, there's different ways to address it. A high quality component of your overall health strategy, right? So it helps with pain relief, weight management, reduce hunger, blood pressure maintenance, boost digestive health, may lower the risk of cancer, and there's studies to back this as well. Incredible. They even mentioned ginger here to boost anti-cancer activity. Like I said, other spices can really help, and especially when they're combined with other spices as well, so creating that synergistic combination as they would in Ayurvedic medicine as well, because the body has all these organs that work together, so it only makes sense that all these foods that we consume also work together for our body, and hopefully everyone like you and me watching this video, you know, is working together and trying to fit and reach our goals, for example. Next we have siblings of children with intellectual disabilities score high on empathy and closeness. Now this is something to just learn about in life, right? Because sometimes we can use science as a way to say, okay, well, we can learn a little bit from life, and you know, science just basically proves what is just going about in life, and sometimes we underestimate these relationships that we build. But it says researchers use artwork to assess relationships of developing siblings. The sibling relationship is the longest most people will enjoy in their lifetimes and is central to the everyday lives of children. So it's incredible what they found here, but the very fact that people who had more, you know, intellectual disabilities had more empathy just shows you that, you know, that's incredible. It keeps them awake, keeps them going, it keeps them motivated, and that's what's going to keep you motivated through it, is having somebody with you, okay? Regardless if you have a disability or not, it doesn't matter. But they teach us, actually, these individuals with so-called disabilities, which they don't, right? They just have certain areas of more ability than others, frankly, right? And a lot of them are geniuses in certain areas, for sure. And it says, you know, intellectual disabilities, don't let that be a title for you, but look at the fact that it's helping you be closer to someone because you feel like you need a missing part of your life and you need to fit in this puzzle piece. Exactly. You don't know it all. You don't have it all. You need other people with you. You need other people to help you in this life. That's exactly how we should look at life, because this can actually teach us a lesson when it comes to just disability. Well, no, we all have disabilities. We all have abilities, and we all just have to share those abilities with each other to fill in those disabilities, to fill in those gaps, to fill in those voids, so we can create this bigger picture, to which health means whole in Latin, this bigger circle of life, we would call it, right? Incredible. And so talk about closeness, right? Being close, but not restricted, but being secure, being safe, from harm. And then empathy, when do you see a billionaire being truly empathetic, or are they just putting on a show, or are they a puppet of the system who doesn't really feel, and that's why they always want war, right? We got to question that, because children could actually teach us a lot, and siblings and these different things that happen in life, and karma, which you might see kind of related to this situation, is going to teach us about what our life really means, what is the truth beyond it. So now we have here low-fat diet linked to lower testosterone levels in men. So it's just growing, the scientific body of research, the fact that, well, you shouldn't go low protein or high protein especially, and then, looking at high fat, low fat, high carb, low carb. A lot of these studies are contradicting each other. So then we have, having this lower testosterone thing. It just shows you, though, that there is a big trend right now going toward higher fat diets, right? And that lower carb diets are starting to be more effective, even though in the 80s we said the complete opposite thing. So, it doesn't make sense. Is it because we're not seeing results? But frankly, if anybody switched to a higher carb or higher fat diet, they actually seem to do better for a shorter amount of time. A lot of it's short term because they can't make it a lifestyle, frankly, because they're following a diet that's very restrictive. We see benefits because they're not doing the standard American diet, which consists of a lot of processed foods, as I cover in my video called The Food World Order. So it says, low-fat diet. I'm not surprised, because that's the whole reason why this paleo-keto movement is growing. And so it says here, Dr. Fantis and co-authors note that further studies will be needed to collaborate their findings and clarify the mechanism by which restrictive diets reduce testosterone. But due to the difficulties of large-scale dietary studies, definitive trials are unlikely to be performed. Therefore, our data represent a valuable approach towards answering this most important question. And it is most important because, well, it's fertility, and we see fertility rates dropping. We see a lot of the sperm count is dropping significantly. You're talking like downfalls in many cases. And it's sad to see, there's a lot of chemicals in the water. There's a lot of different things that might be going on. It's not just the diet, but the diet has a big part to do with it. And maybe it's not just about restricting and taking this thing out and taking this thing out, but maybe experimenting for yourself as an individual, what specific foods, how you react to them, and then maybe adding in those good foods that you love, and then finding variations of that, and then just eating higher quality foods. Not even that you have to look at this quantity. Looking at the quality can sometimes determine then your quantity, and then you'll naturally eat less calories, but calories aren't the answer, and we know this now as well. So it's like debunking all these science myths. They debunk each other, and frankly that there is no one direct answer because everybody's different. So take into account that, yeah, low-fat diet could be linked to lower testosterone. It just shows you, yes, that's why people are moving toward healthier fats, and it's not necessarily to do low fat or high fat. Maybe just moderate, maybe just quality, having it in your diet, and not saying that you're purposely excluding it even though it exists within nature, for example. Right? So let's think about that, right? Let's think about what could we do that exists within nature to fulfill this picture that is less invasive. And that's exactly what I do in my health coaching practice, right? Is find the least invasive way to do this and help people. And it's through understanding that individual body type, that individual body synergy that happens in the body, like I said, and through the spices and through the foods in combination. which you're going to be talking about protein, carbs, and fats, right? Because all these foods are in combination with each other, and how they're digested is always differently, but still all within the same body. And then it's still all being exposed to this environment that's around us, and this environment that we create within our whole body, in our gut, and in different places, right? It's crazy. So we need to look at that. And so 5 evidence-based ways to boost testosterone then, right? Because if people are low in testosterone, what are some ways we can do? It says low levels of testosterone can come with glaring symptoms such as erectile dysfunction and reduced bone mass. Before opting for hormone replacement therapy and facing the risk of serious side effects, here are 5 science-backed ways to optimize your testosterone levels naturally. It says number 1 is zinc. Number 2 is magnesium. Of course, so many people are deficient in magnesium. Incredible. It's known as actually the forgotten mineral. Zinc is actually important when it comes to not getting sick, believe it or not. But the studies have been shown that zinc can do so many other things as well. Magnesium, I mean, as it is, it has like over 500 uses in the body. Weight management, as you know, obesity is connected to everything. Very, very important there. And then vitamin D, I talked about in my previous video. You know, it talked about getting rid of 50% of all disease right off the bat, getting proper vitamin D in your diet. And it doesn't just mean the sun, even though you get full spectrum vitamin D, but it can mean through a nice, just clean, quality supplementation of vitamin D3, so you can get the maximum optimization amount out of your diet. And maybe it's not just like 5,000, it could be 10,000 for you, believe it or not. I mean, really got to look at the individual case. Please consult with a natural healthcare physician for once, you know, not just your everyday medical physician, right? Because wouldn't you want every side? Wouldn't you want to hear all the things that is possible for you, all the things that are possible for you to feel, all the ways that are possible for you to be your best self, right? I would want to know, right? It says, and then 5, adequate is quality sleep, right? They call sleep the best medicine. So I would hope that you can get that. And so what does that mean? How do you get quality sleep? You need to break that down into actionable goals. How do you get sleep? You know, is it checking what you do before bed, hours before bed even? Is it the coffee that you're having in the morning that's affecting you at night? You know, is it something that you have to take before bed just real quick? You know, something natural that's not going to affect you, maybe an essential oil, maybe not a tea because that'll make you go to the bathroom, and maybe something else, right? We have to break it down step by step. Maybe there's something keeping you up at night. Maybe you have a certain body type. Maybe you have to create a certain schedule. What is it that you have to do? You have to break it down, okay? 5 evidence ways to boost testosterone. Make sure you check into these if you are interested.